Once the FDA approves the vaccination in different cohorts, starting with 12 and above, grades 7 to 12, we will begin to apply that requirement in the next term.
California Governor Gavin Newsom, fresh off defeating a recall effort against him, announcing the nation's first COVID vaccine mandate for school children. It comes as the nation passes the once unthinkable milestone of 700,000 lives lost due to the pandemic. Dr. Anthony Fauci joins us now. Dr. Fauci, thank you for being here. I want to start with that number, that just almost incomprehensible number, 700,000 people who have died just in the United States from the pandemic. How did we get here? Did so many have to die?
Well, this is the most formidable virus, John. It is really, you know, from the very beginning has evolved to the point where we're now dealing with this Delta variant, which is an extraordinary virus in the sense, the same virus is still SARS-CoV-2, except that it has a capability of transmitting extraordinarily efficiency. There are certain elements about this that were just unavoidable in the sense that there are going to be deaths, there are going to be a lot of infections globally, no matter what anyone did. But there were situations where we could have done better and we can do better. And I think we're living through that right now, John, because we now have, within our capability, highly effective and safe vaccines. And although we've done well in the sense that we now have 55% of the population fully vaccinated, 64% having received at least one dose, but there are 70 million people who are eligible to be vaccinated who have not gotten vaccinated. So when you say, are some of those deaths avoidable? They certainly are. In fact, looking forward now, most of the deaths could be avoidable if we get people vaccinated, because if you look at the people who get hospitalized and the people who die, it is overwhelmingly weighted towards the people who are unvaccinated. So where we are right now, many of these could be avoidable.
We also have this breakthrough, apparent breakthrough that Merck announced, this new treatment that seems to be able to cut down hospitalizations and severe illness in half. How big a deal is this new treatment?
It's a big deal, John. I mean, you have now a small molecule, a drug that can be given orally, and the results of the trial that were just announced yesterday and the day before are really quite impressive. I mean, if you do a statistical significant analysis on it, it's very, very significant, cutting the deaths and hospitalization by 50%. Importantly, in the placebo versus the drug group, in the drug group, there were 0 deaths. In the placebo group, there were 8 deaths. So that is, you know, no matter how you slice that, that's impressive. So we're really looking forward to the implementation of this.
And is that potentially something that would make the vaccine not necessary?
Oh, absolutely not. That's such a false narrative if someone says, well, now you have a drug. Remember, the easiest way to stay out of the hospital and not die is don't get infected.
Don't get sick in the first place.
That's very good, but yeah. Exactly. I mean, this idea about we have a drug, don't get vaccinated, just doesn't make any sense.
And let me ask you about this new announcement from Governor Newsom in California, a mandate for students, all eligible students, to get the vaccine. And there's no out here. He's not allowing testing as an alternative. Do you favor that, or should testing be an alternative for those that don't want their kids to take this vaccine?
You know, John, I have been and I still am in favor of these kinds of mandates. You can make some exceptions to them, but in general, people look at this like this is something novel and new, when in fact, throughout, you know, years and years, decades, we have made it a requirement for children to get into schools to get different types of vaccines, measles, mumps, rubella, and others. So when people treat this as something novel and terrible, it isn't. A requirement for children to come to school to be vaccinated with certain vaccines is not something new. It's been around for a very long time.
What do you say to those that say, though, this is such a new vaccine that they're reluctant, they want to, you know, for their young children, they just feel, I mean, obviously the other vaccines are required, but there have been decades of experience with those vaccines, and they're hesitant. What do you say to them? How do you reassure them?
Well, John, a couple of things. First of all, our Food and Drug Administration, before they allow something to be given to anyone, it has to be proved to be safe and effective. They are very meticulous in their examination of the data. In addition, John, this vaccine has been given to hundreds of millions of people. So when you say it's a new vaccine, well, you know, when you have a new vaccine that's been given to 10, 15, 20, 30,000, 100,000 people, you're talking about hundreds and hundreds of millions of people throughout the world. So although it is, quote, new, there is a lot of experience with this vaccine.
All right, last question, Dr. Fauci. There has been some good news. It looks like infections are down dramatically over the last couple of weeks. Deaths are still on the rise. That's obviously a lagging indicator. Is it possible that we are finally beginning to turn the corner on this pandemic?
We certainly are turning the corner on this particular surge, John, but we have experience over now close to 20 months of surges that go up and then come down and then go back up again. The way to keep it down, to make that turnaround continue to go down, is to do what we mentioned. Get people vaccinated. When you have 70 million people in the country who are eligible to be vaccinated, who are not yet vaccinated, that's the danger zone right there. So it's within our capability to make sure that that turnaround that we're seeing, that very favorable and optimistic turnaround, continues to go down and doesn't do what we've seen multiple times before, where it goes down and then it comes back up. We can do that merely by getting vaccinated.
All right, Dr. Fauci, thank you for joining us.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.